Okay, sorry, I know I just did a video, but I read this part. Um, I think it's just a paper, not a study. It says, according to the studies collected thus far, how effective are non-selective beta blockers in this setting? Carvedilol is a non-selective beta blocker. The answer is they are very effective at different stages of cirrhosis. In patients who have high-risk varices, i.e. varices that are likely to bleed, non-selective beta blockers significantly decrease the incidence of first variceal hemorrhage. In patients who have already bled from varices, non-selective beta blockers prevent recurring variceal hemorrhage when used in conjunction with endoscopic ligation. The most important component of this therapeutic combination is the non-selective beta blocker. Recent data suggests that in patients with very compensated cirrhosis, i.e. patients who have clinically significant portal hypertension but no or small varices, non-selective beta blockers can prevent clinical decompensation. Thus, non-selective beta blockers are effective at most stages of cirrhosis, from the patient with clinically significant portal hypertension who has no or small varices to the patient who has recovered from variceal hemorrhage. The only thing I don't have is I don't have the actual pressure in my liver. I don't think anybody's taken that. I don't know how you would take that. But that's one of the very few things I don't have. The only reason we know I have portal hypertension is because of the varices and the gastropathy. Because, again, all of the ducts are patent. They're all open. The big ones. Obviously the little ones we can't see. And those are what are getting attacked by my PBC. I actually looked that up. The difference between PBC, which is primary biliary cholangitis, and PSC, which mostly men get, which is primary scleranging cholangitis, something like that. Anyway, men get it more than women do. And it appears that the biggest difference, there's two major differences. One, PSC tends to come with IBS, which, oh my god, really? On top, mine came with celiac, so. But the immune system in PSC attacks the big ducts, the major ducts, whereas mine, PBC, attacks the small ducts inside. So, yeah, not a huge difference, but yeah, I can see why they would be classified as different diseases. But what I don't understand is they're both autoimmune diseases that attack bile ducts in the liver. Why do women tend to get the small duct one and men get the big duct one? I would love to see a study on that, why that is. Obviously it has to do probably with, the genes, what it's activating, maybe there's very little on the Y chromosome, but maybe PSC is something on the Y chromosome. I don't know. I'm not a genetic scientist, but it's interesting. So beta blockers can prevent clinical decompensation. That's what I wanted to read today. That's what I needed to hear. If I could only get the pressure in my liver, the hypertension. I'm sure that's pretty invasive though, so it's okay not to have it. It says a controversy has arisen because these are risks, because non-selective beta blockers also decrease cardiac output. Patients with cirrhosis and refractory ascites may be dependent upon cardiac output to maintain an adequate arterial blood pressure. By potentially reducing the cardiac output, non-selective beta blockers may lead to a decrease in kidney perfusion and to hepatorenal syndrome, a condition with a high mortality. I don't want to be one of those people that needs a liver and a kidney transplant at the same time. So I don't know how to help with that except keep exercising and keep drinking water. I don't know. I don't have ascites, so it might not be something I need to worry about just yet, but it might be something in the future. it says that the arterial pressure cannot be decreased too much, or else other problems can arise. So I imagine this is something they're actually going to have to test for. But nothing's going to be perfect. Nothing's going to... I mean, Ursidil's pretty perfect so far. No major side effects, can be on it for years, but can't have two of the same kind of perfect drugs, right? So, we'll see. We'll see how things go and follow up in blood work, and that's all we can do. I don't think I'm going to come back. I don't think I'm going to find any more blockbuster things in this paper. But thank you for watching again, and I'll talk to you soon, but probably not this soon.